Hello. Good evening, fellow friends and loved ones. Yes, it's once again a very honored and privileged moment to come to to your home this evening. Yes, it's not been so easy, but by the grace of God, you come into your homes to discuss once more again another very interesting topic. It's the glory of God. We had so many discussions. We had so many conditions to talk about. So today we're just going to review on the various topics that we talked about. And then now we go on to our current discussion. So we've talked about conditions such as scoliosis, wrist arthrosis, shoulder bursitis, torticollis, cerebral palsy, meniscal injuries, ankle osteochondral lesions, botanier deformity. We talked about Bell's palsy. We talked about clubfoot. We talked about sciatica. We talked about gout, flat foot, hydrocephalus, arthrogryposis, delayed developmental milestone. We talked about foot drop. We talked about carpal tunnel syndrome. We talked about Erb's palsy, Klumpke's palsy, or obstetric brachial plexus palsy injuries. We talked about frozen shoulder. We talked about golfer's elbow. We talked about coccydynia. We talked about diastasis rectus abdominis. We talked about rotator cuff injuries. We talked about whiplash syndrome. And then today's topic, which is promising to be a very interesting topic, and I'm sure that at the end of the day we'll learn a lot, and then we'll have so many to talk about to the next generation and to the public. Those who haven't had a chance to listen to this video, we have a very good time to educate them on this condition. So today's topic is titled Achilles tendonitis. Achilles tendonitis. Achilles is spelled Achilles. Achilles. Tendonitis is spelled Tendinitis. So Achilles tendonitis. So this is today's topic, Achilles tendonitis, and we are privileged to have us discuss this topic. So before we begin the discussion, we're going to give us a quote, a very important quote, and it says that the difference between who you are and who you want to be is what you do. So the quote states again, the difference between who you are and who you want to be is what you do. So this boils down to passion, and I believe you all have passion to do, and no matter what it takes, we're going to accomplish it by the grace of God. Okay, so we are beginning this discussion in the name of the Father and the Son and the Holy Spirit. So this discussion's outline is the description, the definition, the anatomy, the physiology, the prevalence, the common spots or common areas of injury, the signs and symptoms, the causes, the assessments that physical therapists or physiotherapists go through to be able to treat this condition, and then also we're going to look about some assessment procedures. We're going to talk about some investigations. We're going to talk about some special tests, and then some treatments together with some lifestyle modifications to be able to treat this condition as and when they bring themselves or they be likely to have them. Aside the lifestyle modifications, we're going to talk about some various precautions to be able to minimize the occurrence of this condition. Then we'll sum up with our next topic. So we are hoping that today's discussion will be a very blessed one. So what is Achilles tendonitis? Achilles tendonitis is, there are two words. Yeah, there are two words, Achilles and tendonitis. Achilles is the one who discovered it. So mostly in the olden times, when someone discovers a particular theory or a particular principle, he's named after, such as Achilles' principle, such as Bohr's theorem in physics, and so many conditions. So as in biology also, there's a man called Achilles, and he discovered this condition called Achilles tendonitis. That is what will be known as inflammation, that is swelling, or presenting itself with other conditions or signs, which we'll be talking about very soon. So he noticed that there was a swelling at a particular part of the body, to be specific, the heel region. Okay, so as we go on, we look at some pictures also to be able to appreciate this condition. So Achilles tendonitis, basically put, or simply put, is an inflammation or swelling at a particular part of the foot that is just above the heel. So when you take your heel, if this, okay, so let's look at some pictures indicating Achilles tendonitis so that we don't talk in vague or in vain. Okay, so just a minute. Okay, so I'm sure we can appreciate this. So look at this, the leg. So if you look at this, the heel of the leg. So just above the heel is a structure called Achilles tendon. Achilles tendon. So where we have the red sign there, so you can see there's a red sign there. We'll be showing to you right now. Sorry, there's a red sign there. That's it. So this is red sign indicating inflammation of that structure called the Achilles tendon. Okay, so let's look at some more pictures. So you see, okay, so this is an Achilles tendon. This is the tendon. You can see it here. So when they are inflamed, that is, initially you saw the reddish sign there. This shows that it's inflamed or it's injured by so many causes, which we'll be talking about very, very, very soon. Okay, so this is Achilles tendon. So in the case where they are inflamed, they begin to present itself as swelling or redness around the side, and then it becomes painful and the person cannot even move very well. So this Achilles tendonitis. Achilles tendonitis, that's what we are talking about today. Okay, so we are still talking about the Achilles tendonitis, and it's quite an interesting topic to talk about. Achilles tendonitis, yes. So we've seen some pictures indicating where the tendonitis occurs. That is where you have the swelling occurring. So Achilles tendonitis is actually inflammation of a structure around the heel region called the Achilles tendon. And this tendon is very, very important because anytime we stand, if this structure is not so strong, we are likely to fall. Or even not walk at all. So it's a very important structure. If you take an animal such as a horse, it has a very strong tendon. Yes, that helps you to walk and run very fast. Same as human beings. So we have a structure called the Achilles tendon that helps us to be able to walk very well and without slipping to the right or slipping to the left. It's very strong tendon. Okay, so as we proceed, we talk about the physiology. So how does it act? So there's a particular part of movement that we have 5 forms of movement in the foot. We have one we call heel strike, so where your heel hits the ground, and we have the foot flat, that is where you have the whole foot on the ground, and we have the mid stance where you have the whole body coming to stand straight, and then we have the second one, the fourth one, we have the heel raise, and then the last one we have the toe raise. That propels you to be able to move forward. So these 5 stages of movement are very important for us to be able to walk well. And when we have the Achilles tendon not functioning or pain around that side, you realize we can't even put our heel on the ground, and this also inhibits movement and effective movement. Okay, so now we look at some of the prevalence. So research carried out in the past stated that anyone can be affected despite the gender. So it's not gender specific. If you're a male or female, you can be affected. And then, but research showed that people who are engaged in more sports are likely to be affected, or those who work a lot. So if you work a lot, you're likely to cause this structure to be weak, and then we are likely to have Achilles tendonitis. Okay, so sports such as football, volleyball, rugby, ratchet football, American football, you are likely to have your Achilles tendon injured. Also, it comes also with age. So as we age, this structure begin to weaken, and they don't have the strength that is needed to go to work well, and they are likely to have Achilles tendonitis. So as we look at the prevalence, which is not gender specific, and the fact that people who are older are also likely to have this condition, research also shows that most people who are males tend to be on a high risk of having this condition because they are more active, and also males who are between the ages of 30 and 50 because they are more active and they are likely to engage in high impact activities which could cause the tendon to be inflamed or to be injured. So what are the signs and symptoms of this condition called Achilles tendonitis? So one of the signs is that you could see that the place becomes warm to touch, the place becomes reddened in color. If not reddened, the place becomes swollen, or we have difficulty in movement, or the least touch there is pain elicited or pain felt around the side. So what are the symptoms also to this condition called Achilles tendonitis? First of all, one, the patient or the person is not able to move the foot as best as possible, and there's one thing that we call antalgic gait or painful gait. So when the person is walking, the person limps on one foot, that's the affected foot, and is not able to walk as best as possible. Okay, so what are the causes of Achilles tendonitis? There are so many causes, as we talked about earlier on, that engaging activities, high impact activities as sports can also cause Achilles tendonitis. Okay, so now we're talking about assessment. So as a physical therapist or physiotherapist, what are our role in terms of treating such condition? So when we note, or when a patient comes to a physical therapist and we note that the person has difficulty in movement or raising the leg or moving the foot, we move to the Achilles tendon and check if that place is painful. We check if that place is warm to touch, if the difficulty in movement, and then we zoom into treatment. Unlike other conditions that we discussed previously, that we require X-rays, that we require CT scans, MRI, this condition actually is not really the extreme form. The extreme form is where we have the whole tendon tearing, and that's what we call Achilles rupture. But in this condition we're talking about, is just an inflammation, so we don't really require an X-ray or an MRI or CT scan to be able to diagnose and effectively treat this condition. So it's not really necessary to take an X-ray when we have this condition. You are not likely to spend enough money or much money in treating this condition. So as physical therapists also, we also carry out special tests. So trying to stand on your toes when there's pain elicited, when you are trying to stand on your toes, that is, stand on your toes, or even sitting down and raising your heel up. When there's pain elicited, there is likely to have an Achilles tendonitis or an inflammation to the Achilles tendon. Okay, so then when we note that, then we go into treatment of this condition. Okay, so what will the treatment be like when you see a physical therapist? Okay, so first of all, a physical therapist is noted to go through various processes. First of all, one, he's supposed to go through a very principled protocol called RICE. RICE. It's an acronym called, meaning rest, ice, compress, and elevate. So as early as possible, within the first 3 days or first week, we go through, so you rest the affected leg. That is where the Achilles tendon is. Reduce movement if you walk a lot, reduce your movement at all. If you are going to work, don't go to work at all, and then you ice the particular place. So you put ice around the heel, and then you compress. You either you wrap around that side with bandage, and then you can elevate it. When you're going to sleep, you put your leg on the pillow to allow blood to flow back into the heart. And this also is very important so that we don't have swelling around the foot. It could lead to other complications such as DVT, which we will not talk about today. So in case the pain is so severe, we can go to the medical doctor, or we prescribe medications for you to take. Medications such as aspirin, Advil, other pain relief medications or analgesic to relieve the pain and then to reduce the inflammation. So after all these things, then now when the pain settles down, which will enable us to effectively carry out various exercises, then we start physical therapy. So we'll be looking at some pictures of various exercises, but I'm just going to illustrate them verbally, then we could look at the pictures now. So the first exercise we do is that the patient lies on the back and then moves the foot. So if this is the foot, move the foot forward and backwards, forward and backwards. So it allows a little stretch around the heel of the foot where the Achilles tendon is. So if this is my foot, the Achilles tendon runs down like this and then to the leg. And so when I stretch backwards like this, the Achilles tendon stretches. So if there's swelling around that side, it reduces the swelling and stretches forward, backwards. So these are minimal exercises that we do in the first few days of the injury. If the pain is not so severe, when the pain is very severe, we minimize activity. That's the first thing to do. So when the pain starts to come down, then we start stretches. So we call scientifically dorsiflexion stretches and then plantar flexion stretches. And also we have toe raise stretches. So the person sits down, raises the heel up and down, up and down, up and down. These are various minimal and first line action stretches. So as time goes on, with the pain coming down, with the swelling coming down, then we start some strengthening exercises such as standing on the toes and raising of the leg up and down, and then standing on one leg, and then sometimes standing on a staircase. So the heel is off the staircase, and then person goes down and up and down and up. So various pictures will be shown to you right away to be able to understand and appreciate the illustration that we are talking about verbally. Okay, so let's look at the pictures of the condition we're talking about today. Okay, so this is the Achilles tendon. This is the tendon. It's a very long tendon that crosses to the heel and crosses down, and this is very important to hold the foot in place to enable us to walk. So we can see the picture now very, very clear. You can see it here. This is the Achilles tendon. It's a very strong tendon. If it's weak, in fact, you can't walk. You can't walk. That's how God has made it, that it can hold your whole body in place. Without them, the swelling there, you can see the redness. That shows that there's inflammation there. This you can see also another one here. This is a normal Achilles tendon. Okay, and then we can see the inflamed Achilles tendon. Okay, another one here. So these are the microstructures in the tendon. Now, yeah. So this is also the inflamed tendon there. Yeah. Okay. So we have two types of the Achilles tendon. We have the non-insertional Achilles tendonitis and the insertional Achilles tendonitis. So these are basically the groups of people that occur. So it occurs so you can see that it involves the lower portions of the heel where the tendon attaches the heel bone. So occur at any time, even when people are not active. So the insertional Achilles tendonitis can occur at any time, but this one, the non-insertional Achilles tendonitis occurs when we are more active, but the insertional Achilles tendonitis occurs when we are not even active and not doing anything. It could occur where there could be injury to the Achilles tendon. Okay, so this is also, so we can see written the signs, the symptoms. You can have pain, burning sensation, you can have tenderness, and then it also become chronic. We can see it there, and we could have the tendon sheets here. You can see the swelling around the Achilles tendon. It's very, very important to note that and treat them accordingly as health professionals. So you can see the swelling around the heel region. So it's very important that when we notice this, we report to the medical doctor or the physiotherapist as early as possible. So you can see the swelling here. You can see the redness here, that shows there's inflammation or swelling around the Achilles tendon. The extreme form is where we have the total tear, that's Achilles tendon rupture. But we're not talking about that one today. We're talking about the Achilles tendonitis. Okay, so you can see some of the same things also include the stiffness, pain, difficulty in exercising, thickening of the tendon, the bone spread, that is growth of the bones around the structure there, swelling that is constant because we tend to move often, even with the pain. Some people are able to endure pain a lot. Okay, so these are the exercises that we're talking about. So the person is holding something we call a TheraBand. So it helps to push resist the pushing of the foot forward and backwards, and this helps to strengthen the Achilles tendon that is under the foot. Okay, and these are also another exercise called the stretch exercise. So the calf stretch to strengthen the Achilles tendon. We also have a step up exercises to strengthen the Achilles tendon. We have the reach forward exercises. We have the single leg standing toe raise exercises, and then we have the abduction exercises. We have the standing calf exercises. So there are so many exercises that we go through as physical therapists to treat this condition called Achilles tendonitis. Aside that, we have a device called the kinesiotape, and this is wrapped around the foot to the lower leg region, and this helps to relieve pain and reduce swelling around the structure there. Okay, so this also a very, I'm sure we can appreciate this condition. I'm sure with the picture we won't forget about it, and then be able to tell so many people about this condition. Okay, so this is how far we come with this condition called Achilles tendonitis. I'm sure that we've learned a lot. Any question we can, any question please, any question, all questions are welcome. Okay, so I believe we've all got idea of this condition called Achilles tendonitis, and then we'll be willing or able to explain to anyone about this condition. And then okay, so this brings us to the end of today's discussion. Thank you very much. So acknowledgement to some of, as you can see, Haruna, I can see Kofi, I saw earlier on other people joining in. Thank you very much for your time. Yes, I'm sure we learned a lot, and we'll be in a good position to talk about it. So in case you are unable to listen or able to watch this presentation, it will be on various social media. It will be on YouTube, it will be on other social media, and then we'll be able to understand. As the routine is, after this presentation, we will see some pictures on Facebook, and then we can appreciate this condition the better. Okay, so I can see another one joining. Okay, so I've not seen the name yet, but thank you very much for your time. So next week's presentation is titled plantar fasciitis. Okay, I can see Fiavi coming at the year. Okay, thank you very much for joining. If you want the full video, you can check on YouTube. You can see it on. So thank you very much for your time, and have a blessed week. May the Lord be with us all. May the Lord protect us. May the Lord be with us all. So next week's discussion is titled plantar fasciitis. The flyer will be rolling out soon. Have a blessed evening. Take care. Goodbye. Good night. Bye bye.